A lot of times patients come to us for a lot of symptoms and say that they've been suggested an endoscopy elsewhere. So when does a doctor suggest to do an endoscopy? An upper GI endoscopy is a process where a thin tube with a camera at its tip and a light source is passed from the mouth through the food pipe into the stomach and intestines. This is done to look at the lining of the food pipe, the stomach, and the proximal part of your small intestine called the duodenum. By doing an endoscopy, we can look at if there is a problem, including ulcers, if there is a cancerous growth, if there is any infection, or if it has become narrowed. Accordingly, we can do treatment also by taking biopsies, and if an active bleeding is going on, we can stop the bleeding. So an endoscopy has both diagnostic and therapeutic implications. Should you get an endoscopy done is the next question. Routinely, an endoscopy is done when we are not sure of the diagnosis based on clinical history symptoms, or when we want to rule out a condition, a more serious condition. So when do we suggest an endoscopy? If you are more than 40 and you have recent onset of symptoms, if your symptoms are not improving despite taking medications, if you are experiencing worsening of symptoms despite taking medications, if you have loss of appetite, if you have severe pain abdomen, if you have vomitings that are not subsiding with medications, if you are noticing black color stools, if you are losing weight, or if you are feeling some difficulty in swallowing. These are all called as red flag signs, and if these are there, it means that something more troublesome could be there and we need to rule out by doing an endoscopy. If you have any of these, consult your gastroenterologist and get an endoscopy done.